Give me an example of a question or two that someone would find. Give me an idea of how difficult the question may be.
Georgia has some of the questions right here.
Please look at a list of the following community issues on the next page. In your opinion, which are the top 5 issues that most affect quality of life in Wayne County? And it starts with from A to Z: alcohol use, allergies, poverty, prenatal health, violent crime, just everything we could think of. In your opinion, which one health behavior do people in your own community need more information about? Eating well, nutrition, exercise, fitness, going to a dentist, elder care, crime prevention, domestic violence?
So they're asking a lot of opinion questions.
Very much.
What about personal health? Are there any questions about that?
Here, example, there's a question about tobacco use. About if you smoke and what kind, or if you use any tobacco products, and then it asked where would you go to find help if you wanted to quit, and it lists several options: your doctor, your church, your pharmacy, a private counselor you don't know, and other. It also asked about prescription drugs and access to those and cost.
I'm sorry, but the questions are meant to be encompassing of both community, because that's what it is, a community health assessment, and also asking some personal perspective, because that's what we want to try to achieve with the data, is to see what do you know about your community's awareness with health, because we're not just focusing again on direct clinical services, we're looking at an overall healthy community, and a lot of that, it doesn't necessarily have directly to do with medical care, but also about safety in your community, because you can't be healthy and get out and walk if you don't feel safe, if you don't have access to healthy foods. If you have a personal problem with, say, tobacco use or alcohol use, do you know what you can do to get help with that? Are you aware of that? If you have friends that have those problems, can you help them? It's about the awareness, and because the utilization of the resources we have in the county is based on what community knows we have or what we don't have.